Welcome back guys. After discussing about the touch and different types of touch receptors, now let's discuss about the pain. Okay. See, for pain, actually there are no receptors. There are no specialized receptors for the pain. The free nerve endings, like the free nerve endings of the first order neurons acts like a pain receptors or nociceptors. Okay. There is no specialized receptors like Meissner's, Merkel, Pacinian, Ruffini's. There is no specialized receptor. The free nerve endings can act as a pain receptors or nociceptors, we can say. So, first highlight, free nerve endings acts like pain receptors. Now, just like touch, see there are different forms of touch, right, like fine touch and crude touch. In the same way, pain is also of two types. One is fast pain or acute pain, and the second type of pain is called as a dull or slow pain. There are other names also, like fast pain is also called as acute pain, sharp pain, like epicratic pain. These are all different names, and slow pain is also called as a visceral pain, protopathic pain. Okay, these are different names. Basically, you can say pain is of two types, fast pain and slow pain. Now, what's the difference between these two pain? Let me tell you. Fast pain means whenever someone comes with a pin, okay, pin or some knife, whenever you are having a cut or whenever someone is pricking you, okay, poking you with a pin, what kind of pain that is? That's a sharp pain. That's a very sharp, okay, localized pain. But whenever you are having visceral pain, like a stomach ache, okay, or knee pain, that's going to be a dull pain, slow pain, okay. Or you can say it's like a diffuse pain. You cannot say this is the exact place where I am having the pain. So there are two types of pain. One is a very sharp pain and slow pain. What you should know for your exams is fast pain is carried by, okay, who is going to carry the fast pain? You just tell me whenever I comes and touches you, whenever I come and touch you, who is going to carry the touch sensation? The touch sensation is carried by a fiber called as a beta fiber. A beta fiber is a first order neuron. In the same way, when I came with a pin, I am coming with a pin and I am pricking you. So that's going to cause the fast pain. You can feel the fast pain. Okay, you can have a very fast pain. So that fast pain is carried by a first order neuron called as a delta fiber. A delta fibers. Now from this A delta fibers, the information where it will go, the information will go to the spinal cord. Okay, and from the spinal cord where the information will go to the thalamus. Okay, the information is going to the thalamus. And thalamus is a place where you can actually feel the pain. Okay, thalamus is a place where the pain is actually felt. It's not felt in the cortex, the pain is felt in the thalamus. Okay, that's a very important point. Pain is felt at thalamus. Okay, pain felt at thalamus. Of course, the information about the pain will also go to the cortex, but the feeling of the pain, you felt it actually in the thalamus. Next, what about this dull and protopathic pain or visceral pain? So they will be carried by a different types of neurons called as a C type of neurons or C fibers. And from the C fibers again same, like almost like a same information. The information will go to the spinal cord, and from the spinal cord the information will go to the thalamus. Okay, but there is a difference in the pathways. But you can say for now, this can serve the purpose. Yeah, the fast pain is carried by the A delta fibers and slow pain is carried by the C fibers. Okay. Now question is, so what is this A beta fiber, A delta fiber, C fiber? Okay, we are seeing different types of fibers, right? So what is the difference between these different fibers? Okay, let me tell you here itself. In our body, the entire neurons are classified into three types. There are three types of neurons in our body. Okay, so now let me write here the classification of neurons. Okay, so how the neurons are classified in our body? Scientists classified neurons into mainly three types: A type of neuron, B type and C type. Okay, the neurons are classified into A, B, C types. Based on what? Based on their size, you can see. A neurons are big in size, B neurons are bit less in diameter, and C neurons are even smaller in size. So based on the size, the neurons in our body are classified into A, B and C types. These are the three types of the neurons. Now, any other differences are there? A neurons, they are having this covering. So what is this covering called as? This is the myelin sheath. A neurons are highly myelinated. But what about the B neurons? B neurons also myelinated but less when compared to A. B neurons are also having little myelination. But what about the C neurons? C neurons doesn't have any myelination around them. So now tell me, what are the differences between A, B and C? When you go from A to B to C, who is going to decrease? It's the size or the diameter, you can say. The diameter is going to decrease. A neurons are having a large diameter and C neurons are having less diameter. And that one more difference is about the myelination. A neurons are heavily myelinated, highly myelinated, and C neurons are unmyelinated. Okay, and not only that, one more difference is there. What is that? Which neurons do you think will conduct the electricity quickly? The conduction velocity. See, A neurons are having a lot of insulation around them, lot of myelin sheath is there. Okay, so A neurons will conduct the electrical impulse very, very quickly, very, very fastly. Okay, so when you go from A to C, let me write, when you go from A to C, what and all going to decrease? Okay, what and all going to decrease? First of all, diameter decreases. Next, myelination decreases. And conduction velocity. So, they are going to decrease, and this was the recent exam question, conduction velocity. Okay. So, whenever the neuron size decreases, who is going to decrease? Is the conduction velocity going to decrease. Next, A, based on their function, A was further divided into subtypes. A was further divided into alpha, beta, gamma and delta. Okay, alpha, beta, gamma, delta. Where we have studied about the A alpha. See, we have already discussed about this A alpha. Okay, alpha are nothing but the alpha motor neurons. Alpha motor neurons. What do they do? Alpha motor neurons. You know what is the alpha meaning? Alpha means it's a subtype of A. Alpha motor neurons are the motor neurons which are going to cause a muscle contraction. Okay. Next, what about the beta? Where we have studied about the A beta. Just now we have studied A beta neurons. A beta neurons are going to carry the touch information, touch and pressure. Okay, touch and pressure. And what about the gamma? Where we have studied about the gamma? Gamma are nothing but gamma motor neurons. Just like alpha motor neuron, gamma motor neuron. These are, they are also purely motor neurons. These gamma motor neurons are going to cause a contraction of the muscle spindle. In every muscle, there is a muscle spindle present. Okay, muscle spindle, and that muscle spindle also will contract, and who is going to cause the contraction of those muscle spindles? It is the gamma motor neuron. Okay, alpha causes the contraction of the extrafusal fibers of a muscle. Gamma will cause the contraction of the intrafusal fibers. Okay, I already have discussed this in the topic of the types of lower motor neurons. There are two types of lower motor neurons, alpha motor neuron, gamma motor neuron. That this topic was already discussed in the topic of types of lower motor neurons. But again, I am telling you, what is the function of alpha? Alpha is going to cause the contraction of the extrafusal fibers of the muscle, or you can say the myocytes. And what about the gamma? Gamma is going to cause the contraction of the intrafusal fibers, nothing but the muscle spindle. Okay. Next, what about the A delta? Where we have studied about the A delta. Just now I have taught you A delta are the ones which are going to carry the fast pain. But if you can remember, also remember, it will also carry cold sensations. Okay, cold sensations, cold as well as the fast pain. And where we have studied about the C fiber, just now I have taught you, C fiber is the one which is going to carry the slow pain. Okay, as well as hot temperature, slow pain as well as hot temperature. Okay, slow pain and hot temperature. So based on the function, A was further classified into A alpha, beta, gamma, delta, something like that. Okay. Now we will discuss about in detail about the classification of neurons in the topic of the nerve physiology. But for now, just you know, A beta is going to carry the touch, A delta is going to carry the fast pain, and C fibers are going to carry the slow pain. That's it. Now what else you should know regarding the pain? See, what are the chemical mediators of the pain? Which chemicals are going to cause the pain? Okay, histamine, serotonin, bradykinin, prostaglandins, especially E2, prostaglandin E2, okay, acetylcholine, potassium ions. What they will do, see these chemicals, whenever there is inflammation going on, okay, whenever there is a cut, so inflammation will start, you know, this inflammation is going to produce these inflammatory mediators. What these inflammatory mediators will do? These inflammatory mediators, they will surround around, they will come and stimulate the free nerve endings, you can say, simple like that. Okay, they are going to accumulate around the free nerve endings, making the threshold less for the pain. Now, okay, now you can feel the pain easily in that area. Okay, even with a slight touch. Okay, whenever you are having a cut or whenever there is inflammation in this area, even if I come and touch over there, even with the slightest form of touch also, you can feel the pain. So what I am trying to say, these substances, look, all these substances accumulate around the nerve endings, and lowers what? Threshold for the pain sensation. Okay, so these are the chemicals which are responsible for the pain. Out of all, bradykinin is the most potent allergen. It's the most potent allergen. Out of all, this is the most potent allergen. Allogen means the chemical responsible for the pain. Okay. Next, what else you should know regarding the pain for your exams? Okay, I am talking everything in the exam point of view. Now, allodynia. The term allodynia is important. What is allodynia, sir? Allodynia means the perception of a non-painful stimulus as painful. Perception of a non-painful stimulus as a painful. For example, I am coming and I am just touching here like this. Okay, I am just touching here like this. So tell me, is it a painful stimulus? No, definitely this is not a painful stimulus. But if a person feels it painful, then that is called as a allodynia. So perception of a non-painful stimulus as a painful. Okay, it is seen with certain diseases like fibromyalgia, something like that. But if a person feels a non-painful stimulus as a painful, okay, that's what is called as allodynia. So now let's discuss an example for the allodynia, which was recently asked in the exams. See, one foreigner who visited to India, he went to Goa. He was like, basking under the sun. Okay, he was just like, undergoing tanning, process called as a tanning. He was just basking under the sun. So this lazy fellow, he got slept. Okay, he slept in that sun. Now tell me what will happen if he is sleeping there for 4 or 5 hours. Okay, so that's going to cause a sunburn. Okay, now this patient is having a sunburn. This person is having a sunburn. Now he went to his hotel. Okay, back to hotel, and he just opened the shower. So when he opened the shower, what happens? When he opened the shower, what happened is a lukewarm water is going to fall on his skin. Okay, lukewarm water is falling on his skin. So tell me how he is going to feel. It's a lukewarm water only. It's not a painful stimulus. It's a normal stimulus. But how he is going to feel? Now he is going to take it as a painful stimulus because it's going to cause a burn, because he already had a sunburn. So he already had a sunburn. He is having inflammation in that area. Big inflammatory mediators are produced. Now he is having a low threshold for the pain. Okay. So even a non-painful stimulus is going to cause a painful sensation. So that is what is the allodynia. Now examiner will try to confuse you with the other totally different other term. So that is called as hyperalgesia. So now what exactly is this hyperalgesia, sir? Hyperalgesia means perception of mildly painful stimulus. Perception of mildly painful stimulus as extremely painful. So this is hyperalgesia. There is a big difference. What is the difference between allodynia and hyperalgesia? In allodynia, it's a non-painful. See, it's a non-painful stimulus causing the pain. In hyperalgesia, you are giving a mildly painful stimulus. But if a person takes it extremely painful, if a person feels it extremely painful, then it is called as a hyperalgesia. Okay. So there is a slight difference between these two. One is non-painful as painful, The other one is a mildly painful as extremely painful. So that's the difference. Okay. Terms you should be very much careful. Next, after this, let's discuss a gate control theory which is related to the pain topic. What exactly is gate control theory? Okay, very, very important for your exams. Gate control theory. And see, this gate control theory is given by Ronald Maslach and Patrick Wall. Okay, Ronald Maslach and Patrick Wall, these are the two people who gave this gate control theory. So what exactly gate control theory is telling us? Gate control theory tells us the transmission of pain signals. Okay, the transmission of pain signals from first order neuron to second order neuron to the thalamus. In this way, the pain signals are going to the thalamus, right? The pain signals can be actually modulated. You can change this pain signal transmission. You can modulate it. Where in the spinal cord itself, at the level of spinal cord, you can actually inhibit this pain signal transmission in the spinal cord itself. How? By giving a non-painful stimulus. So you start to give. See, imagine the person is having a wrist pain today. Let's say the person is having a wrist pain or elbow pain, shoulder pain, knee pain. Now, whenever the person is having pain in this area, okay. Now, in the same area, you try to give a non-painful stimulus. When you give the non-painful stimulus, actually the pain sensations are reduced. The pain signals can be modulated. The person will feel now less pain. How? How is that possible, sir? Let me tell you with an example. Today, your friend, let's say he is having the knee pain. Okay, knee pain. So knee pain is going to be a dull pain. Okay, dull diffuse pain. It's not a sharp pain. Now, this dull pain, see the pain signals from the knee is going with the help of first order neurons. See the C fibers, which are the first order neurons, which are taking this pain signals. Where these pain signals are going? See, the pain signals are going from the knee region to the spinal cord. Okay, first the information will have to come to the spinal cord. Now in the spinal cord, the information from the first order neuron will be going to the second order neuron, and from the second order neuron the information will go to thalamus. The information will go to the thalamus, okay, like this. The neuron is depolarized and the information is going to the thalamus, that's normal. But today what you are doing, you are giving the non-painful signals, like rubbing on that area, okay, you are rubbing on that area, like giving massaging, hard packs, cold packs, all these things you are doing, you are giving a non-painful signals. So tell me what happens if you are giving a non-painful signal, that is actually going to activate the A beta fibers. The non-painful signals activates A beta fibers. So now from the same knee region, A beta fiber is activated. Now God designed our spinal cord in such a way, always this A beta fiber, see the A beta fibers, one of the branch of the A beta fiber, okay, one small piece of this A beta fiber, it is coming and it is activating this inhibitory interneuron in the spinal cord. So now this inhibitory interneuron is activated. Now tell me what will happen. Now these are the inhibitory interneurons. Now what they will do? They will inhibit the things. So now the second order neuron is completely inhibited. Now the second order neuron is inhibited, or you can say hyperpolarized. Okay, now the neuron is inhibited. Now do you think it can carry the electricity? Now do you think it can carry the action potentials to the thalamus? No, because this inhibitory interneuron is inhibiting the second order neuron. So do you think the pain signals, can they reach the thalamus? Pain signals, will they be transmitted to the thalamus? Not possible. So not possible, because the second order neurons are inhibited. How? Because of the A beta fibers. How? Because of giving the non-painful signals. So always remember, this is the summary. Giving a massage to your friend, okay, giving head massage or knee massage, like body massage, will actually give you relaxation, will actually decrease your pain, right? What is the reason? Gate control theory. Okay, so massaging, hard packs, cold packs are going to activate the A beta fibers. A beta fibers are going to activate the inhibitory interneurons. These inhibitory interneurons are going to inhibit these large second order neurons which are traveling in the spinal cord, and the pain signal transmission to the thalamus is actually inhibited. So automatically you will feel the less pain in the thalamus. Okay, so this is the gate control theory. Why we are saying the words gate? You can actually close the gate. See what I have done? I have totally closed the gate for the pain signals. Now do you think the pain signals can go to the thalamus? No, because I have closed the gate. Closing the gate means inhibition of the second order neurons, the pain signals are not getting transmitted. Okay, so how you can expect an MCQ is, see, there is an apparatus called as a TENS. What does TENS stands for? Transcutaneous electrical nerve stimulation. Okay, transcutaneous electrical nerve stimulation. See, it's an apparatus actually. TENS is an apparatus. It's an apparatus. So now this apparatus, imagine this apparatus is with a physiotherapist. Okay, it was there with the physiotherapist. Now what the physiotherapist will do, whenever you are having any fracture or any ligament tear, something like that, he will come to your home, or you have to go to the the center, and he will ask you to do the exercises. Okay, that's everyone knows. But they will also perform this TENS. Okay, transcutaneous electrical nerve stimulation. What is this transcutaneous electrical nerve stimulation? The name you have to understand. So transcutaneous means through the skin. Through the skin. By using electricity, you are stimulating the neurons. For example, let's say I am having the wrist pain today, or knee pain, or shoulder pain, something. Now it's a TENS apparatus. We are going to attach some electrodes here. You are going to attach some electrodes. Now what these electrodes are going to do? These electrodes are going to transcutaneously, through the skin, they are going to stimulate the A beta fibers. Okay, now in this region, specifically the A beta fibers will be activated. And whenever the A beta fibers in this region are activated, what they will do? The A beta fibers are going to inhibit the second order neurons which will carry the pain pathway from the same region. So TENS apparatus works on the principle of what? This TENS apparatus, it is designed in such a way, via using this electricity, you are going to activate A beta fibers in the same region. Now whenever the A beta fibers are activated, and the pain signal transmission to the thalamus will be inhibited. So now tell me, TENS works on the principle of, this is a question asked, TENS works on the principle of gate control theory. Okay, TENS apparatus works on the principle of the gate control theory. Okay, so with this, we are done with the gate control theory also. Always remember, giving a non-painful signal, giving a non-painful stimulus actually decreases the pain signal transmission. This is called as the gate control theory, given by Ronald Melzack and Patrick Wall. Okay, done. Next, after this, few more important points about the pain. See, the first order neurons which are carrying the pain sensation. We all know the first order neurons will carry the pain sensation to the spinal cord to a specific region called as substantia gelatinosa. So what is the substantia gelatinosa? Substantia gelatinosa is a nucleus. which is going to receive all the pain signals. Okay, let me give you the clarity. Let's say this is the first order neuron. Okay, so what this first order neuron is doing, the first order neuron, now it is carrying the pain. Okay, it is carrying the pain. Now, where do you think this first order neuron is going? It has to go to the spinal cord without any doubt. The first order neuron has to bring this information to the spinal cord. Where this information will go? The information will go to the specific part of the spinal cord, a specific nucleus of the spinal cord. So that is called as a substantia gelatinosa. So tell me, what is substantia gelatinosa? Substantia gelatinosa is a nucleus in the spinal cord which is concerned with receiving the pain sensations. Okay. Next. So what about this stress condition? See, whenever you are in stress, what will happen? The stress is going to produce endogenous cannabinoids. So these are the natural painkillers, guys. Endogenous cannabinoids. What they will do? They will also do the same thing, like inhibition of the pain signal transmission to the brain. So whenever you are in stress, imagine yourself in a war situation, or imagine yourself in a place where there is earthquake. So whenever there is an earthquake from the top, like lot of things are going to fall on you, but you are not concerned about them. You are not going to sit and cry. You are rushing. You are running away from that region. After some time, you will come to know that you are having some abrasion injury, grazing injury, or you might even have a fracture. So you are not having that much amount of pain when it actually happened. After some time, you will have the, after that stress comes down, you will feel the pain. So whenever you are in such a stressful condition, imagine a soldier in a war. He is not going to be worried about small injuries. He is not even worried about the bullet shots. After some time, he will come to know that he is having some injury. So what I am trying to say, so this stress is going to cause the analgesia in the body. Stress induced analgesia. Okay, whenever you are in stress, stress is going to produce what? Stress is going to produce the endogenous cannabinoids. These endogenous cannabinoids are the painkillers, natural painkillers. Okay, they are going to decrease your pain sensation. In the same way, whenever a person undergoes acupuncture, okay, whenever a person has undergone acupuncture, acupuncture for pain relief, the acupuncture is going to release the endorphins. Now these endorphins, same, they are also natural painkillers. They can also inhibit the pain signal transmission to the thalamus. So these are the two natural painkillers, endorphins and cannabinoids. Okay, so these are the painkillers. They will decrease the pain signal transmission to the brain. You will feel the less pain. Okay, so with this, what we have completed successfully, we have completed the topic of pain. We have first discussed about the touch and different types of touch receptors, and now we have discussed about the pain. And what are all the things you should know regarding the pain? So how many types of pain are there? Fast pain, slow pain, and carried by the two different types of the nerve fibers. And nerve fiber classification is very, very important for you. And what are the chemical mediators of pain? What are the chemicals which are causing the pain? And what is the difference between allodynia and hyperalgesia? And what is exactly the gate control theory? And which order neurons are getting inhibited in the gate control theory? TENS works on the principle of the gate control theory. And what exactly substantia gelatinosa concerned with? Because substantia gelatinosa is not concerned with the touch, it's not concerned with the vibrations, it's concerned with the pain sensations. Pain sensations, all the pain sensations will go to substantia gelatinosa. Okay, and acupuncture releases the endorphins, and stress releases endogenous cannabinoids, especially anandamide. Okay, anandamide is a endogenous cannabinoid. Okay, so with this, the pain signal transmission topic completed. Hope the video is helpful. Thank you.